Hey everyone, welcome to the Fuel the Fight podcast. I am Lieutenant Colonel Nick Barringer, your host, and we have a stupendous episode for you today because we have a very special guest, Colonel Enrique Smith-Forbes, the program director for the Doctorate in Occupational Therapy. Sir, thanks so much for joining us on the show.
Yes, good day, Colonel Barringer. Thank you for having me.
No, it's great having you. Can you talk a little bit about your Army story before we dive into the OT piece and what brought you in the Army?
Yes, I would love to. I'm originally from Panama, and my stepdad, he's a retired Sergeant First Class from the Army, and he actually always said that we would be good, my brother and I, to join the military. So I initially started. We left Panama, and I came to the U.S. and joined the Air Force, enlisted. And that's where they assigned me to the field of occupational therapy. And surprisingly, I did not know it at the time. The course was right here at Fort Sam Houston, and in the 68 Lima course. And back then was the 91 Lima. And so they assigned me to the course, and we were Air Force and Army working together. And that's where I learned about occupational therapy. And since then, I have been involved in the military, either active or in reserves, and came back on active duty in 2015, joined the Army, and here we are. And now I'm surprisingly, the world turns around and created this new program for the Army Baylor OTD program.
Yes, and that's what's so amazing is, the other, folks we've talked to from the grad school, those programs have kind of been established. Most all of us, like me and myself, we've kind of just fell into a program that's already up and running. You built a program from the ground up. Can you talk about that?
Yes. Well, actually, we're still building the program.
Yeah.
So because of the new vision that the Chief of Staff had for the Army for the holistic health and fitness system, and the creation for expanding the pretty much the SP core programs, we did not have for occupational therapy an entry-level program that will actually help us have soldiers that can graduate and meet the needs of the Army. The way for occupational therapy, the way that we access soldiers are getting direct sessions, but then we have to train them up in areas like in upper extremity, because in the military we go above and beyond our licensure, civilian licensure, for upper extremity practice, and also for behavioral health, mental health. We're part of the Combat Operational Stress Control Unit, and also for areas like wellness and everything else that we do. So because of that, there was a call for a creation of this program, and because of my prior experience teaching as in the DScOT program, the post-professional program, I had the credentials to be the director. So we started this program, and the program will have graduates that will complete and be able to, day one, meet the needs of the Army in any area. They'll be trained in all of these areas, and that's what the Army is looking forward, and to meet the need for the holistic health and fitness.
Wow, I love it. There was a call, a demand, and really kind of the supply didn't meet that demand, and so now you have a program so we can grow our own military occupational therapists. Can you provide just like a quick overview of the program?
Yes, the program is it's here at Medical Center of Excellence, and it's a brick and mortar program that is 30 months long. It's two phases. The first phase is a didactic portion of 18 months here at the Med COE. And the second phase is 12 months. The students then get a TDY to do their internship and capstone experience and project during that 1 year. So the program we are sponsored contract the degrees through Baylor University, so they get that degree. So the program actually is a very good deal because we get soldiers that are either in the military or civilians. We can get individuals right from off the street that are going to come into our program and become occupational therapists to serve in the Army. So the requirements for the program is that they need to have a bachelor's degree, and then after we have 9 courses that are prerequisite courses that they need to meet, and of course then meet the requirements for the military to join the military.
Nice. So, they come in, they've got their bachelor's, they want to come in, be a social worker, they enter your program. Can you provide kind of what's a day in the life of your typical student in the program?
Yes, for to be an occupational therapist in the program, a day that they normally would do would be they start out at 7 o'clock in the morning. They go ahead and do their PT, and then they have an hour to finish about 8, and an hour to then to do hygiene. They start at 8 o'clock with the didactic portion, and that could go anywhere between 1500 to 1700 of the day.
So anywhere from, for those not on military time, from 3 p.m. to 5 p.m.
They will finish up with the didactic portion. That's correct.
Okay. So and then probably some homework there, and, maybe
homework and activities. Yes, that they would do. There some days they will have breaks in between in which they focus on homework, research, and meeting the deadlines and assignments.
Nice. So that's the student side of it. As an occupational therapist, and I know there's so many different roles you feel, but probably what most of the OTs at the clinic, what does a typical day look like for an OT, out in the Army?
Okay, for an OT in the Army in the clinic, it varies depending on the setting. So let's say if they are in the outpatient clinic, normally they will start something similar probably at 7:30 in the morning, and they go until 4:30 in the afternoon, and they will see anywhere between 8 as a minimum to 10 patients, and these are hour-long appointments in which they will either evaluate the patient or they will do a reevaluation. They work in conjunction with the occupational therapy assistant with the different type of treatments that the patient might need, and they're doing as occupational therapists, we serve as physician extenders, meaning that we have direct access, so they are able to have that individual come in directly to them, and then order either the films, labs, or could be MRIs or whatever diagnostic testing, do the diagnosis, and find out if it's within our scope of practice, and if it is, then treat the individual independently, and if not, then we can refer to other sources, but then we can provide a good referral because we already have done all the diagnostic testing for them.
Nice. So you have the clinic, they're doing the assessment. What about, can you talk a little bit about the combat stress role?
Yes, the combat stress role is, that's our Army War Mission role. And we're part of the behavioral health team. And for occupational therapists, our role is not to diagnose in behavioral health or mental health. For occupational therapists, our function is primarily on work skills. We look at the individual and their ability to complete the job and or accomplish a task that is important to them. So we look at their ability to function, their work skills, their ergonomics, the mental and cognitive problems that they might have. They could be stressors that individual is going through. So we do a lot of life skills training. We go over anger management, assertive communication. We look at how they communicate with their family members overseas, and how do they manage being in that stressful environment. I did the role of combat operations stress control while I was deployed in Iraq, and one of the things that we have within the combat stress units at the level 2 in theater is that we have the restoration center, and that's one of the areas where occupational therapists work strongly, and we help individuals that are spiraling down and not doing well in the theater to help them to stay in the fight. And primarily they will come for the restoration portion that is like for 3 days. And in those 3 days, we have the individuals come in. We help them to maintain their military role, and that means that they're keeping their uniform, they're still carrying their weapon, and we're helping them to kind of sometimes clarify values. Why is it that they actually joined the military? And figure out really why they're doing what they're doing, and we give them some reprieve for them to be able to rest, to get nourishment. And then usually in 3 days, they're ready to go back into the fight and stay in theater rather than having to be lost to the unit and coming all the way back here to the U.S. And that's a loss of unit to replace that individual.
No, that's great, and I'm glad you shared that, because I feel like, fellow military is a lot of people don't know about that mission, right? Unless you're kind of in this small circle, and it's such an important mission, and it's so valuable. I definitely wanted to get that out there. What's the most challenging thing about being an occupational therapist?
I think that what's challenging is just only our name as occupational therapist. It's it is a misnomer, as people would normally think that if I tell them I am an occupational therapist, they'll think that I'm trying to get them a job. But it's not that. Actually, again, occupational therapists look at the skills, the job of the skills of living for each individual. So that means helping an individual achieve those goals and those things that are important to them, whatever it might be. And there's a full spectrum. The spectrum could be either that they start from, let's say, at the hospital working in acute care setting. It could be that you have a stroke patient that can barely get off, sit up in bed, and cannot dress, cannot groom themselves. So the OT will help the individual do all of those things, either by providing compensatory techniques to do that, or by strengthening and helping them achieve those basic things that are important to them. And that's on one side. And then on the other spectrum, it could be an individual that's very capable but has life goals that they can't do, and we work as coaches to help them achieve those things that are important to them.
No, again, that's the other aspect, the mental piece.
Yeah, the mental
goal
readiness,
setting and all like that. Another great skill set. So what's the best thing about being an occupational therapist? What do you love the most about being an occupational therapist?
For me, it really energizes me. I like helping people. I like helping people achieve what's important to them. It's actually a paycheck in itself. Being able to see an individual that either physically could not do what they needed to do and be able to help them to then achieve, to be able to do so, or even mentally, that for some reason had some level of brokenness, and be able to get them to that point where they're resilient and doing well and going way beyond what you could expect. So that's the satisfaction.
Nice. If you had a crystal ball, what does the future look like for occupational therapy, say in the next 20 years?
I would think right now for occupational therapy with the holistic health and fitness, I think not only for occupational therapy but for the whole Army, we are positioning ourselves in a place of power worldwide. As we look at other governments right now, other countries right now, like the conflicts like in Ukraine, where you have some situations where the Army is not as strong. By having the holistic health and fitness system, getting individuals to be resilient, getting individuals to stay in the fight, getting individuals to understand their role and have that moral fortitude to do the right thing, I think that's where we are very strong, and it will pay strong dividends for us in the future.
Is there any exciting research? Because I know you have your PhD and really have your finger on the pulse for OT research that's involved out there that you're currently tracking. You wish more people should know about, or?
So right now the focus is on there are different areas that we focus on for upper extremity, but also mental readiness. That's what we're looking at, and our students actually in the program are going to be presenting at the AOTA meeting next year on they're doing some systematic reviews and mental readiness, and then finding out the different areas that they can slice out their different capstones. So that's exciting as we are getting deeper in this new area of mental readiness, getting deeper into how we can better help the soldier.
Right, because now we're talking about you had the combat stress side where you're trying to get people back in the fight.
Right.
Now you're talking about taking that person who's in the fight and optimizing.
Optimize, exactly. Yes. So it's a big paradigm shift from rehabilitation to pre-rehabilitation, and that's what is great with this H2F holistic health and fitness system, that we are looking at the individual before the injury happens. We're looking at the individual before the either physical or mental injury would occur, and to keep them in the fight and helping them to be strong. So that's very exciting.
Oh, yes, yes. For folks that are interested in your program, listening to this, they're like, hey, I want to be an occupational therapist. What can they be doing now to prepare for your program?
I would say right now, the main thing would be to ensure that they have a bachelor's degree. That's the first thing. And then after that, they will have those 9 courses that are the prerequisites for the program. They can actually find that information if they Google Army Baylor OTD. Our website for the program will appear, and we have all the information for application. One thing that we have changed starting this year is that we're going through our national clearinghouse for applications for occupational therapists, and that is OTCAS. And through that system, they can apply. They will begin in next year in July of around or about July 2023. That's when application window will start opening again.
And just to be clear, your program, it's open to individuals who are outside the Army, but also inside the Army as well.
Absolutely. Inside the Army, we are right now in our getting the administrative part for the 3rd cohort, but for the 1st cohort, we had 11 students, and a great number of them were prior military, and these are enlisted or officers that can apply, and we had just 2 individuals from the outside. And now for the 2nd cohort, we have 16 students that should start in January. And we have a greater number, about 5 individuals now that are civilian that are coming, but we still have military that are applying. So it's a win-win for both the military and for people on the outside.
Right. So if soldiers are listening to this and you're listening to what, Colonel Smith-Forbes is saying, and this sounds interesting, this sounds enticing, we'll put the link, to the program in the show notes so you can click on that and look at that, because that's a great opportunity to get free education.
Free education. So the students, once they are selected, they get paid as a 2nd lieutenant or more, depending on constructive credit, and then they get all the benefits that you get as a Army active duty. You get your pay, then you get pretty much your tuition is completely paid for Baylor University, which is now it's an R1 status university, and also you get $1,000 a year for tuition and books. So it's you can't beat that on the outside.
No, it's great economically. Another piece I did want to talk about is the advanced education you can get once you come in as an OT, right? So you guys have programs where folks can go get their doctorate. Can you talk about that?
Yes. So once the individuals once they're done with this entry-level program, after their first once they finish their first tour of duty, they can apply through the long-term health education and training program. We have 2 degree options. We have a post-professional DScOT, a Doctorate of Science in Occupational Therapy. That program is going to be 24 months now. It's at BAMC. It's a clinical doctorate where you're actually getting improvements in upper extremity and also with mental health, and you do a research dissertation that you actually publish, and then graduates from that program then can serve in multiple areas. And we also have, through the long-term health education and training program, the school of choice for your PhD. So you have that option that you can go to any PhD program in the civilian world, and you complete your PhD. You have like 3 years to complete it.
Yeah, and so just to highlight again, you're getting paid while you're doing that PhD.
Yeah,
you don't owe anything.
You don't you don't owe anything. You get paid, and those years count towards your retirement. In any of these programs, those years are counting for your retirement. You're getting paid, and you're getting an education. So it's a very good deal. Actually, that's what I did myself. I went to a PhD program.
Myself as well. I will say I do want to clarify, the thing you do owe back is time. So you will owe more service time, but that time counts towards your retirement. And you're getting paid. So
yes, to clarify, that's correct. And even for the entry level program that we have, the OTD, there is it's a you do 30 months, and then you owe a total of you do 60 months, which is 5 years. So you owe 5 years for those 2.5 years that you do. But still, it's not a bad deal.
Not a bad deal at all. Any other, kind of, closing thoughts or things you want people to know about your program?
I think it's a very exciting program. It's new. We are in the process of getting, we got a candidacy approval from our accreditation body. We're in the process of getting the accreditation submitted. The self-study is next year. We'll do that in July, and looking forward to in 2024 to be fully accredited. So that's where we are pending right now.
Nice. Well, sir, thank you so much for coming on and talking about this awesome opportunity to be an occupational therapist in the Army. I've worked with you and many other occupational therapists, and what OTs bring to the fight is not talked about enough, right? Because it's so vital, and you do so much great work. So thanks again for coming on the show.
It's been my pleasure. Thank you very much. I appreciate it.
Yeah. Thank you. Hey, that's all we have for today. Have a great day. Glad you listened. Wherever you listen to your podcast, please like and subscribe. Until then, we will see you next time. Signing off.